At Five Star Bank, community is at the heart of what we do. Every day we strive to have thoughtful solutions for our customers and help our communities prosper. Honest dialogue about the issues affecting the region is vitally important to that prosperity. We are proud to be part of the conversation and hope you'll join in.
In 2011, the first of the baby boomers reached what used to be known as retirement age. In the coming decades, boomers will be turning 65 at a rate of over 8,000 per day. How will aging and the institutions that serve the aged change to serve a generation that is used to redefining life and culture on its own terms? Joining us are Pam Miller, Executive Director of the Area 4 Agency on Aging, and Dr. Donna Yee, CEO of ACC Senior Services. Given that boomers change everything in their wake, how is the word aged going to apply to them?
Well, one of the things that's happening is that, people age at a different pace nowadays. And so if somebody expects to retire when they're 65, it's possible they'll live to be 100. That's
true.
So that even as many boomers say, I'm not old at 65, don't call me a senior, it's also true that we're continuing to provide care to many more people who are between 80 and 100 years old. And so in many ways in older adult services, our focus in terms of health care and support for people who have disability still remains with the older population. I think for boomers it will take another 15 years before we see substantial numbers of boomers who are really considering where they need care and whether they want to choose institutions for care.
Do boomers know how to be old?
I don't think they want to admit that they're going to be old. And so that's a challenge in a way.
I see Keith Richards bouncing around the stage, and I'm always worried that he's going to break something.
Could happen. But I think the other thing that we're going to see is people staying and working much longer because the retirement dollars aren't going to last 35, 40 years. And we're also seeing people who have retired and then gone through the recession and are now coming to us to help become employable so they can go back to work.
That's a really big issue. Not just the impact of the recession itself and how it destroyed retirement earnings or savings, but just as Dr. Yee mentioned, the runway in terms of how long we're going to live. Have we as a society really come to grips with the fact that living to be at 100 is not as exceptional as it was, say, 30, 40 years ago?
I don't even think people have started to think about that yet.
Really?
Yes, and that also means that we're going to have people that are older adults taking care of their parents who are even more of an older adult.
Wow. The stress on caregivers, just that issue in itself, the stress on caregivers is so strong. Is there a support system in place to deal with that reality?
Well, it's difficult because much of our work with family caregivers is convincing the 90-year-old mother that she should have her daughter help her. And the daughters who are over 65 are not always thinking about who their caregivers are going to be. And so sometimes it's really a challenge because just as one person can fall on the spouse breaks her arm, the spouse needs a lot of care and the spouse hasn't thought about what caregiver resources she has because she's been spending all of her time and energy taking care of her husband or her partner.
Wow. This intergenerational caregiving that's taking place, and at the same time, we as a society, in larger measure, have been having less children per family. Is today, do most people receive care that are aged in the home, or do they receive it in institutions?
Well, I think today most people want to receive it in their home. You know, some people do get to the point where they do require placement, but I think the goal of most people is to age in place. And, you know, there are all sorts of things springing up, we're calling them villages, that are helping provide services so people can age in place.
How is it that baby boomers, as they age, how are the services that they're going to be demanding or looking for any different than what's historically been provided?
Well, I don't think that your typical baby boomer is going to be anxious to go to a congregate meal site as the traditional congregate.
What's a congregate?
A congregate meal site would be going to, like, at noon to a senior center and sitting with 60 to 100 other folks receiving the same meal. I don't know that that's going to be the model of the future. I don't know that baby boomers are going to particularly want to do that. One of the things that we're trying in Yuba City is something called the Dine Around Town program, where we give folks that are 60 and older meal vouchers, and there's 3 restaurants in the community that they can take their meal voucher to, order off of a menu, so they can have a meal selection. You know, they can go with their families to these restaurants, and we're finding that to be a really popular
That's interesting,
program.
and restaurants are actually buying into that.
Yes, we're actually contracting with more of the mom and pop restaurants, and so it helps their business, helps them keep going, as well as it helps us provide a place where our senior citizens can go and become, you know, social, meet other people in the restaurants. And it's working out really well.
And for folks that are taking advantage of these evolving services, what can we expect in terms of societal changes that are going to have to take place as a consequence of all of these people from this generation moving into retirement, or maybe, as you described in the beginning, semi-retirement, because some of them may work in some fashion?
Well, I think one of the biggest dimensions is that people need to plan for accessibility, because none of us knows who's going to need new knees, new hips, is going to not be able to walk for more than a block. And I think there's a lot of planning ahead that needs to happen, and you don't have to have a disability to plan ahead. A big move in the housing industry has been to push for more universal design and planning. And I think similarly, you know, we have a lot of these homes now that were built about, 20, 30 years ago. They have these wonderful step-down living areas, and they're really hazardous for older people.
Sure.
People have falls, they can't get up and down. I was visiting someone a week ago who said she's now given up using her living room because she can't get up and down the stairs. And yet her goal was to stay at home. So she and her family sort of did an inventory of what space she had left in the home to live in.
And how much was left?
It wasn't very much. She was, when I visited her, she was sitting sort of in the space that leads to the kitchen, but that's off hall. And they had put a telephone there, a light there so she could read. There was a small, easy chair. So people are going to be making a lot of choices as they realize that their abilities change, the amount of support they need changes, what they can do as an independent person changes. And one of the things I think service providers are really endeavoring to do is to make sure people have choices, and that the choices are acceptable choices. So in the 1970s, the choice was totally institutionalized care or being on your own in the community. And we've now had, about 50 years of experience figuring out how to make institutions less institutional.
Well, help us out here. So if I'm a child and I have a parent or a loved one who their mobility is decreasing, their health challenges are increasing, give us some guidance on what's the rule of thumb in terms of when we need to start thinking about our loved one or parent living by themselves, and when the indicators are that they're going to need something along that spectrum you've just described?
Well, I think the key factor is that it's not top down. There isn't a transfer from the parent to all of a sudden the child becomes the parent of the parent. I know a lot of adult children feel that way. I'll wait until mom gets older. I'll wait until she has a drastic event. But basically, we should begin these discussions early on. And I think the more older people are able to talk about how they're progressing in their disability or in their management of their illness, it's more than just reporting what the doctor said, but it's really a checking in with how are you doing and what might we do about it. We have a lot of sitcoms on television where we joke about old people complaining. And actually, I think the content of many of our discussions with older persons in our family can really be much more caring. And I think with a better ear to listening, we can really be more attuned to the needs that people have. So we don't have to wait until the person is hospitalized because they had a fall. You know, we can begin talking about safety in the home or the kind of assistance people need to get in and out of an SUV as opposed to a sedan.
Sure.
Or whether or not someone can continue taking a bus trip to the casino
Right.
because they can't get up and down the stairs.
Well, Pam, your agency works multi-county and sees a lot of these issues. What are the common mistakes that families make when they're trying to plan for caring for their aged family members or for other loved ones, that you just kind of shake your head and say, wow, that would be easy to fix if they just approach it different?
I think, as Donna said, the first thing is to really talk to the older person to see what they want. You know, they're an adult, and
That is a kind of a novel thought.
yeah, and you know, just because they're older, they're still an adult and have the right to make the decisions about where they're going to age and how they're going to age. So I think that listening to them is helpful. You can also reach out to other agencies that provide information and assistance and tell them the story.
Well, where do you go?
Any of the area agencies on aging will provide information and assistance, and there are a lot of other organizations for older adults that provide that. You call and you tell your story and ask, you know, what are
And there are
the
actually
resources
people
that are
who
out
pick
there?
up the phone and listen?
Absolutely. And there's also something now called options counseling, which is a person-centered approach where you can meet with an options counselor and they will help you plan what your future is going to be as an older person based on what you want.
For those that are at a point where it is that they've decided, though, that they want and that they need more care than they're able to provide on their own, how are the menu of options evolving at this point?
They're not evolving as well as I would hope. For people who are eligible for Medi-Cal low income, they can get in-home supportive services through the counties, and they can get someone to come into the house and help them. But and for people with a lot of money, they can certainly hire it. But there's that whole middle section of the population where, you know, hiring care in your home is expensive. And so that's the conundrum now, is how do we provide care to the middle?
You can bankrupt a family.
Yes, exactly.
Or the individual in question. Well, let's talk about money for a second. We talk about the sitcoms and some of the jokes that are made about the elderly. There's also a very serious discussion that goes on in this country somewhere on a daily basis about the allocation of resources between the aged and the young. And it is set up as a very much a zero-sum game. And there's some who posit that we spend way too much money on the elderly for the extension or preservation of life. This is really in a healthcare context, or in support services that comes at the expense of younger people who don't vote and have no ability to advocate for themselves. What's your response?
Well, my response is that if we spend more money on what we call long-term care supportive services, it actually saves money, because if we can keep people aging in a healthier way and with care, then they're not going to experience the really expensive health care costs. If we provide them with good nutrition and the tools that they need, then it shouldn't cost as much in the healthcare field.
What's your perspective on that, Dr. Yang?
I think we often totally underestimate the wealth of resources that older people can bring to the table, both in their wisdom and their choices. Most people won't choose sort of survival at any cost. You know, they have a measured notion about what they're willing to live with and how they're willing to live. So the notion that older people are going to sort of take the money and run is really a specious notion. I think if we move more towards intergenerational programs where we think about the family as a unit, keeping families together, assuring that older persons can be engaged in what's happening in the family, I think that having these nuclear families where young adults have to take care of young children with the notion that they can be totally responsible for them and raise the children is really burdensome. We have many older persons who can be available. You know, does it need to be tied to blood relationships? Can it be other programs that are more multi-generational? I think there are a lot of possibilities we haven't considered.
What is it in the possibilities that we haven't considered? Where do you think that we as a society, because of whatever notions or assumptions we have about our aged population, are we not taking advantage of in terms of either maximizing their participation or their contribution?
Well, for instance, we've had several people in our program who retire and they're going on trips and they're looking at their friends who are taking care of grandchildren and they say, I'll never do that. But when their first grandchild comes along, they're half the time living in the city where their grandchild lives. I think we need to better support that and let people know this is a great thing that they're doing because many young families really, especially if both the mother and father work, don't have the time to provide the level and kind of care and cultural nurturing that they would want their child to have. And this is where, you know, a lot of people are very touchy. Well, I don't know if mom wants to come. You know, I don't know if my son wants me to be there. I think that if we, as perhaps in the old days, had more explicit discussions about that.
Did we really have more explicit discussions in the quote-unquote old days?
I think in the old days, parents often made their expectations pretty explicit about what they expect their children to do, or the fact that if their children had children, that they expected to help take care of the grandchildren. I think we've kind of lost that social expectation. We kind of think everyone's off on their own. But I think in intact communities where there's a lot of social supports for people to take care of each other, it's more normed.
When you talk about intact communities, that could be geographic, that could be cultural. Is this problem or this issue, does it defy generalization because it's different depending on where you're at or what community you're dealing with?
I think so. If you look at the LGBTQ community right now, one of the things that we're finding is these folks that fought so hard to come out of the closet, as they're aging, are going back into the closet.
What?
Because they're fearful that when they're placed in long-term care that there's going to be some discrimination. Especially that's true among our transgendered older people. They're very fearful about what's going to happen when they go into like a nursing home or need care.
Is there any evidence of that?
Yes, there's been some studies done, and that seems to be the trend. And we're also finding that sometimes in this community there aren't as many children to take care of their parents. I think that's changing now, perhaps as gay and lesbian are able to marry and adopt children or have children. But traditionally, the older, especially the older old right now, tend not to have as many children, and so they can become very isolated in their community.
Now, your agency, if I understand correctly, was formed out of an act on aging that took place in the 60s?
1965, it was part of the Great Society of Lyndon Johnson, where he came up with Head Start and the Older Americans Act.
And this act does exactly what?
It funds, through federal funds, the area agencies on aging to provide services to folks that are 60 and older.
How is that today, as you look at the work that grew out of the act, how well is that safety net functioning?
It's not functioning nearly as well as it was several years ago because, as you can imagine, we have many, many, many more people to serve, and that's growing and growing. And unfortunately, the funding is not growing with it. And the Older Americans Act hasn't been reauthorized since 2012. And so that really leaves the funding in peril.
But I think it's also true that the funding that is available really has to be severely leveraged in every community.
What do you mean by that?
ACC receives quite a few grants through the Area Agency on Aging for transportation, for Meals on Wheels, for assessment and care coordination. The funding is about 30 to 40 cents on the dollar of what it costs to really provide the services. So we need to do fundraising. We need to ask seniors if they're able, if they could help make donations toward the cost of their service. We need to do a lot of work in the community to basically bring goodwill in the community in support of the services for seniors.
Where do you see the biggest gaps in services today? Where are the needs not being met?
I think the greatest need is that the world of healthcare is changing, and we have not figured out for the everyday person how they're going to get access to the care they need. There are a lot of systems changes, a lot of people have ideas.
Is that the transportation? Is that a transportation issue?
If the big hospitals decide to work for national for-profit syndicated firms because these people provide meals and they're delivered frozen, but they totally overlook the local Meals on Wheels program where somebody will actually visit people in the home, every few days. I think that's sort of a systems problem. And I think we need to pay attention to the ways in which community-based providers will be a viable part of the systems as they change and really connect the healthcare needs together with the supportive service needs that people have in the community.
All right, so beyond that, where are the other holes? Where are the gaps that have to be plugged?
Affordable housing is huge. There's a lot of older adults that are homeless or can't afford to live somewhere that's safe. And so I think affordable housing, and that is not something that the area agencies fund, but we get a number of calls regarding that.
And is it that they've been displaced, they've sold off their homes, or just the nature of the economic circumstances that we talked about a few minutes ago?
Well, I think it's all of those things. And, I think it used to be that the goal of folks was when they retired that their house would be paid off.
Yes.
And I don't think that happens much anymore. I think people move more. Housing is more expensive to begin with. Sometimes they have to sell their home because they can't afford it after they retire. So I think there's all sorts of factors involved.
What is, from your experience, what good? We've painted a little bit of a dire picture. Is there any good going on or any progress that you see on any fronts that you say, gosh, that's a point of hope?
Well, I think the fact that organizations are starting to work together and really collaborate, and I think that's where the hope is going to be.
More of a more coordinated, more thoughtful, intentional use of resources?
Right. But going back to Pam's earlier point, the number of older people are increasing. The number of poor older persons may increase to a slower extent, I think. So there are still actually the majority of older people who do have assets, who do have a home, who do have adult children who are willing to support some of the cost of their care. And I think that one of the main challenges is helping people make those plans and decisions.
And
so should I get home care now? Should I have somebody come 3 times a week for 2 hours and pay them $15 an hour to help me go shopping to make sure I have adequate
And
food?
we're going to have to leave it there.
Okay.
Thank you. And that's our show. Thanks to our guests and thanks to you for watching Studio Sacramento. I'm Scott Syfax. See you next time right here on KVIE.
At Five Star Bank, community is at the heart of what we do. Every day we strive to have thoughtful solutions for our customers and help our communities prosper. Honest dialogue about the issues affecting the region is vitally important to that prosperity. We are proud to be part of the conversation and hope you'll join in.
All episodes of Studio Sacramento, along with other KVIE programs, are available to watch online at kvie.org/video.